like Slim's got a little paper cut.
It's nothing.
Come on, man. No, I'm gonna make you tell me.
Hey, kidney transplant.
When, dude? I didn't know you were sick.
I was donating it.
You gave your kidney to a complete stranger?
Yeah, saved his life.
And save a life by being a living organ donor on matchingdonors.com.
No. Okay, we're going to call the meeting to order. Madam Secretary, do we have
We have a forum, Madam Chair.
Thank you. We'll go directly into visitors' comments. Any comments today? There being none, we will go on to addition and changes to the agenda. Are there any additions or changes to the agenda? There being none, I'll go on to the consent agenda. Has everyone looked at the March 9th agenda approval and the February 16th, 23 minutes approval? We have a motion to accept the consent agenda.
So moved.
Thank you. Second?
I will.
It's been motioned seconded to go with the consent agenda. All in favor?
Aye.
Opposed?
Aye.
Consent agenda is approved. Strategic initiatives, financial fiscal year 23 fiscal report by Piper. Thank you.
We don't have financials yet. You'll get those Monday.
Monday? Okay. Okay, let's go on to the finance committee report. Carrie, do you have anything?
No, we didn't have any financials to discuss. So the only thing that was, an item was follow up on the, Casey Peterson, thing that we had talked about last month. And, did you want to present it?
Internal audit, you mean?
The internal audit is not completed yet, but it's getting closer.
Yes.
It's getting
Close.
much closer. There was a discussion on, Casey Peterson, giving us a proposal to do some in-house accounting, as a consultant. So there is a proposal or a talking points in everyone's packet just for discussion. We haven't made any decisions or recommendations or anything yet. We're still kicking around options. So
And I did request a proposal from Heidi Bailey. And then, I will also get with the individual that has, the CPA in the community that has relocated
Okay,
here
great.
to see if that's something he's interested in as well. And then we'd have 3 proposals.
Okay. That sounds good.
Piper,
Hello?
who was the third one?
It's Shannon Ballard's husband.
Okay,
He's the PA that, we hired that works in the ER. They recently relocated to Newcastle.
right.
He's a CPA and he does, he's done hospital audits in the past.
Great, thank you.
So the discussion on the contractor for the next year's audit is going to be dependent on a lot of what we decide with our internal CPA. So there is no great hurry. So just to let you know that we are working on that, and once we have all the proposals in order and some recommendations on it.
When will we have to have that decision? Before next board meeting or after?
No, we have a while.
We're good?
Yeah.
Okay.
The end of the fiscal year is not till July, and the audit would start after that, and
Right.
it usually
I
doesn't
know.
commence for months after
Right.
that. So we have.
We have plenty of time.
Yeah,
Yeah.
really.
Yeah, we have plenty of time to decide.
Okay, very good. We'll move on to grant reporting update.
So the COVID grants, the reporting that was due March 31st for the COVID monies that received, that is all done and reported on, and that was verified with Kelly at Casey Peterson. So that's done.
So we're pretty good with everything that.
Yes.
COVID, huh?
Yep, and they said if there was any reporting that would happen to come up, which they don't foresee since we've reported on all the monies that we got. they would let us know, but they don't foresee that happening because we have reported on everything that we've received.
You want to talk about the ARPA or DOH funds, or they're all set to go, aren't they?
They're all set to go. So all the grant agreements were signed and submitted. All the architect agreements Allison reviewed, and those were signed and submitted. So now we're just waiting for architect plans. And then once we get finalized plans, then we'll have to wait for state approval to start any of those projects.
And then we go to bids, right? Yeah. Okay. Quality. The medical staff credentialing has been reviewed by quality and approved. So does anybody would like to give me a motion to accept the credentialing?
And this month we have Dr. Reimer, he's due for reappointment. Dr. David White, he's a radiologist at Dakota Radiology. And then Dr. William Zavitz, he's also radiology at Dakota, so. And they're all just reappointment.
So moved.
Okay.
Or maybe I should, or
Do you have a second?
second.
Really more discussion? The only thing that I noticed is that the insurance date was
3/1, but I requested a new.
already, so it's been taken care of. It's good. Already, for purposes. Okay, we have a motion and accepted, seconded. Do we have any more discussion? All in favor?
Aye.
Aye.
Opposed? Motion carries. Medical staff report with Kim.
So, we talked this last month about doing a manner formulary to kind of cut down on some of the different meds that are over there, you know, cutting down from having 10 multivitamins down to just one standard multivitamin, type divvying down on those meds. Joy said that there's lidocaine with Epi, Ozempic, and Adderall all on shortage. And then the nursing home report, we had a census of 37. We're still taking one admission per week. We did have a GI bug go through, but it's since ceased and we've opened it up to visitors again. We had to lock down just to get it under control, but we're open again.
Are doing masking still over there.
For right now, we'll find out tomorrow. Tomorrow's gonna be our 2-week window to see if we can stop masking over there. So.
Can we go back to the lidocaine with Epi shortage? Are you saying that we are short? And what's the plan?
National shortage.
Correct, but
Yeah.
are we,
I don't think
And
we are.
We're getting there.
okay,
We're getting short, yeah.
so what's the plan?
Fortunately, we don't really have
Right
any
on.
backup right now.
Nobody gets hurt.
Yeah.
Yeah.
Nobody gets hurt, okay.
I think regular lidocaine.
Yeah,
is
regular
fine.
lidocaine,
Right.
yeah. But
And you
That-
can
but-
use that. The Epi just constricts those blood
Exactly.
vessels to
So
prevent
that's fine.
bleeding, so you could still use regular lidocaine. You just have a little bit more bleeding.
they look at all the vendors on a daily basis, trying to figure out if we can get it some allocations from somewhere, so. But yeah, nationwide shortage. Saw that on the news.
Okay, Kim, go ahead.
We talked about telepsych for ADHD. Dr. Gomi only provides Jerry Psych, so we're looking into seeing if we can get that here. Results for Honor Camp, we had talked about, the Honor Camp fax number wasn't actually on the order sheet, so we've had them add that to their order sheet. So when they have imaging or anything down here, it also goes up to the Honor Camp instead of down to Lusk. Sometimes they've been going down to there. We discussed exercise stress tests, and it's just not a standard of care. Most of them are nuclear stress tests. You got to have nuke med. And then PFTs, we'll start doing those in the clinic. And then quality. We went over our action queue. We went over the dashboard and incidences. We've got 1 temp radiology staff, 2 labs, and 2 CNAs, and 1 RN in the long-term care. Like I said, we had the GI bug go through the manor. Our ED wait times, our transfer times were a little up from last month, and that's
the hospitals being on diverts and finding them spots and kind of having to hold the patients due to weather. We've had a lot of bad weather lately.
So are we full at the hospital site? Oh,
No.
what do you mean? You said you were. Hold them out?
Like holding the ER patients.
Oh, okay.
Yeah.
Okay.
Yeah, having to hold them
Okay,
just a little bit
okay.
longer.
Mm-hmm.
I thought you said you were, okay, gotcha.
No, no,
I was thinking because we were full.
no, no.
Okay, very good, sorry.
And then- Home health, Carmen's training her new nurse and should be start taking admissions here shortly. And that's it.
Okay. Quality committee report? Nothing. Patty, did you have anything you wanted to report? You're on, you're on,
I thought
There
we
you
were gonna talk about that in the other meeting.
okay. Executive, okay, very good. Confidential stuff then. Okay, old business. The CEO job description,
So, oh, sorry, I apologize. I was thinking we were gonna discuss it before the board meeting.
well, we were
together.
going to, but yeah,
So, I did get with Dottie before she left for Florida.
okay,
The one that you put together is very extensive.
yeah,
And it's almost like it would almost scare somebody off. It's so extensive. What I recommended to Dottie was the job description that she sent forward for the job posting is actually a practical job description for a CEO. So what I would do is start with this, what she
Okay.
had, but I would keep this on hand for the CEO to say, this is what we're expecting from you.
okay.
This is written more like a contract almost.
Or an evaluation more of that.
Yeah,
And that's what
exactly.
we were trying to do was to get our job
Yeah.
description to match the evaluation so that we.
Yeah, you want it more generalized for the
Sure.
job description. So I think if you want to move forward with this as a job description and keep
Okay.
this on the back burner for the evals and stuff, I think that would be good.
But Charlie, we also revised the big one. And I'll send it to you after we're done, if you can open it. I'm gonna try to put it so you can open it, but we cut it down a bit, so I want you to look at it again.
Yes, ma'am, we'll do.
So I think we're probably still on board with that.
Please.
maybe. Okay.
Yeah.
We'll keep it on the drawing board and still keep tweaking it until we get it right. CEO recruitment, it's going along. I can't remember how many we have now.
I think we're almost at 40 morning.
Oh. Okay.
It has slowed a little bit, but I'm still, there's one or two that pop in from
Indeed.
Indeed, yes. I have had several vendors reach out to me asking, I'm like, I think with 40 candidates, I don't think we need to go with.
Well, that's what my question was gonna be. Do you think we ought to just go ahead and close it?
We can, absolutely.
What do you think, guys?
I second it.
It's not like they're bad candidates.
No,
They're all
yeah.
Very qualified.
So the problem is without without set parameters, 3/4 of those people are gonna be eliminated once you set parameters. So to say you have 40 candidates, you don't know if you have 45 candidates because we have no parameters.
Not to mention the salary.
That's the parameter that that's the biggest parameter that I'm speaking of.
Yeah,
Yeah,
yeah.
exactly.
That's gonna thin the herd quite a bit.
So if you close it, does that mean you can open it again?
We can.
Yeah.
Oh, yeah, we can close it. We can even pause it. We can pause it so
Maybe
that,
that's what we need to do, is just pause it until we find out.
and then go through, and if you don't feel like you
Yeah.
have enough, we can open it again and then keep going.
Okay. Do we need a motion for that to pause it?
I don't think so.
No? Okay,
Since we did, yeah, we haven't, we're not doing any action.
Yeah.
no,
Yeah.
other than
Yeah.
postponing it or pausing it.
Yeah.
Okay. We'll be looking at an interview schedule, probably we'll, in exec, we're gonna be going through our prioritization of those 40 some and picking out the ones that we feel like are some people that we're interested in. And then we'll probably get with you and we'll set up a interview schedule and go from there.
Maybe this is later, but how do the interviews work? Is it Charlie do the interviews or how does that?
Well, no, typically I think we'll all do it. Probably try to shoot for like at 5 o'clock. Do you think is that doable? I mean, is that too late? I was thinking of the board members. Some of you guys work, and would 5 work for you?
I can make it work, yeah.
Can you?
Yeah.
Would 5 be okay, or would earlier be okay?
I'd say 5.
5?
Yeah.
Okay. And if they're still working, the applicant's still working, they probably would appreciate a 5
Right.
too, so, okay. We're probably looking at that. I did send out a list of questions to not ask and to ask. Because we just don't wanna tell them your horror story.
So I worked for the state of South Carolina, and there was a interview done that I was not part of. And the interviewer asked the candidate where she was from, and she told the interviewer, and then that person was not selected for the job. That person went straight to the Department of Labor and said, I didn't get hired because they think I'm from the wrong side of the tracks. Of course, she was African American. And I'll be darned if the judge didn't side with her and say, yeah, you don't have any business asking where she's from. The only thing you ever want to know is, can you meet the schedule? This is our schedule. Are you able to meet those requirements? That's all you have to ask. So something as simple as that, and that was a $55,000 fine right there.
So there's a lot of risk. So I think for protection of the facility, we wanna maybe run your questions by Charlie or list some questions as you go through your interviews, and once we decide who we're gonna pick, then
That's an absolute horror story though, but
yeah.
there's always a way to get the information you want. Sometimes you just can't ask it the exact way you're asking it, or there's a safer way to ask what you.
Do you have kind of a matrix set up that we could potentially use?
They're online. I mean, you can pull them. I just know because I've been doing this for a while. But yeah, they're online and through SHRA and all that. So I'm sure Allison has probably heard some stories in her time as well, so.
I think that can be really helpful when you're scoring and.
Yeah, they have scorecards as well too.
That's
yeah.
what I was thinking, was we probably would draft some sort of a scoring.
Just make sure
We won't ask the same question to all the applicants.
I was gonna say, just make sure it's across the board. If you're gonna do scorecards for one, just make
Yes.
sure you're doing it for all.
Absolutely, yeah.
If I could add something real quick, I've also seen committees put together to sort of do all the behind the scenes legwork that you're talking about. And that way it doesn't have to be done in a board meeting. And then you can have the whole board involved in the interview process. So something to consider.
Okay. How do you feel about that?
I'm good with that. I like that idea.
Do you want to do, what committee would you like? Just a separate committee? You mean, Allison, or would you do it under governance or quality or?
Usually it's an ad hoc committee that's just for the purposes of, creating the process for the interviewing and appointment of the CEO.
Okay.
Not that the whole board wouldn't be involved in the interviews but just so that you have a committee who can help make a lot of the background decisions.
Okay. Okay, I think Connie has volunteered to help with that.
I'd be willing if you want me to,
Anne
but not only if you want me to.
and I can do it.
We'll cut down 40 to 39.
No.
40 to 30. That's
What I always recommend is each of you take and look and pull out your top three. Like
Yeah.
these are the three that I like, and then start comparing notes. And I think you'll find that a lot of the ones, you know, they're going to be kind of unanimous, and you'll be like, okay, yeah, we all kind of like this one. And that's a good way to get, at least start to dig into it, because it's an elephant. You
It
gotta,
is,
you gotta start somewhere.
one bite at a time.
Yeah, literally.
Okay.
Tanya, have you been, sorry, have you been a part of this process before of hiring?
Yeah.
You have been on board? Okay, okay.
We were presented 5 candidates. We interviewed 3.
How are you presented? How are they presented to you? Just-
Well, Monument Health
Okay,
was involved in that. And they did the research, narrowed down based on qualifications that we had said we wanted and so forth. So they,
so this will be a little bit different process.
a little bit,
Okay, gotcha.
somebody else
I just
did,
wanna know.
somebody else did the back work.
Right,
You guys will be doing that work. that
Right,
we did.
right.
which I prefer, to be honest. So,
You guys have like an end goal of how many candidates you want to actually interview?
I think we need to find out how many are,
How many you actually have?
yeah, how many we would like to interview, you know, because I don't know what the board has decided yet. So, but I'm thinking,
I would say no more than 5.
that's what I was thinking, no more than 5.
You can always go back if there's
Yeah,
5 and you're like,
right.
you know, after talking to them, none of these are what I want. You
Right,
can always go back and start to dig a little more, you know, so.
go back to the drawing board. Okay. Sounds good. Well, I think we'll go ahead and, do I need a motion on ad hoc committee, or can I just delegate that?
Can I also say, I think it might be nice too, if anyone of the hospital staff has some questions they think would be important for the board to add, let us know.
Yeah. That's a good idea.
I was gonna say you can have a like you can have other committee members who are, you know, maybe medical staff, maybe on the admin side, and then maybe a community member or 2 as well. It's totally up to the board on how you structure that.
Okay.
But you don't need a motion. You can make that appointment.
Okay.
I do appreciate that process. I mean, I've been on hiring committees in school district, and it was always told like admin has the final say, but we want to hear the voices of the teachers and people that, and even students were in on it. So, just hearing other people's voices instead of, you know, what we believe, I think that's beneficial process. I found it to be beneficial. Yeah.
Those that are directly going to be working versus
Yeah.
Right.
those of us with an outside
Right.
view,
Exactly.
I think would be really helpful.
Right. And at the end of the day, it's admin's decision, or I mean, or
Right.
the board's decision, but just get those
It's
voices,
good to get that.
Yes.
input.
voices in there. Yeah.
Moving on to long-term care administration licensure status. Have you,
So I did get an email, the FBI, fingerprint checks are going through, so we should know something soon. So hopefully I'll have my provisional license soon.
good girl. Thank you.
I'm sorry, Piper, I missed that.
Yeah.
I'm sorry.
So I submitted my application for my provisional license, and I had shown Leanne the email I got back. The FBI fingerprint checks were on hold, so they didn't know when they were going to be issuing licenses. But I got an email back when I emailed her and said, well, what do we do in the event we have Maureen has retired, but she we have her on contract until the end of the month. What do we do for our nursing home administrator license? And then I got an email back on Monday that said our FBI contract or whatever has gone through, your fingerprints are being processed. So hopefully I'll have my provisional license.
I had, yeah,
Mhm.
just in case that. I called, long story short, I called Harriet Hageman's office and she got with the state and they made the inroads with the FBI.
Yeah.
So thank you.
Yeah, there was
to
something
Harriet.
with the
Yeah.
contract or something.
Yeah, it was real glitch. It was real glitch in the system.
Yeah.
In fact, they haven't been able
Contract.
to do anything for a whole year.
Right, right.
So it's a
So
blessing. that we got this
Representative
done.
Hageman is a blessing
Yeah.
to all of us.
True statement. Okay.
So back to, we were just discussing, that's why we missed it, but it's Nick, that if Nick, should it be, can we only have 3 board members on it?
Well, that's what I'm saying. How does that change the procedure if you go 4? Because then it's a little bit different if you have 3. I'm okay with being off. I would like to be on, but I mean, if we have, I don't want to change
Because
the
I
procedure.
can back out if you want.
No, I don't. I mean, that's fine. You wanted to be on it, so, yeah.
Don't we have just three?
If you have 4 board members, then it's technically a meeting of the board.
That's fine. I mean, I'm good. I'm good with that.
And maybe it would be good because this is regarding the CEO to vote on the board and that way it's in the minutes. I'm sorry, on the committee, just so that it's in the minutes of who's on that committee and that the board supported the action.
Agreed.
So, do you want to be on it?
No, I'm good. I'm good. Go ahead, Dan. I mean, she wanted to be on it, so that's fine. It's good.
Well, I know, but I just feel like Nick has some good experience, and so I don't want to take his spot. I mean, that's, I mean,
It's not like there's a pay raise, right?
Right.
No.
I mean,
There is 20% more.
And just remember, we all have the candidates. We all have a say. If something comes up that's just, that somebody else has another opinion, we can always talk about it at the next meeting.
Okay. So far it's Connie, Ann, and Leanne, unless, do I need to be on it, Allison? Or can I let Nick on it?
So you don't have to be on it. Normally the chairman is, but there's nothing that requires it.
I prefer you to be on it, to be honest. I mean, just honestly,
Okay,
so you're aware more.
okay. Well, we'll keep you posted.
Okay, you keep, there we go.
Okay, so it will be Connie, Ann, and Leanne.
what's the name of the committee?
It's gonna be called.
How about a motion to approve the CEO search committee, including the following members?
Yes, that sounds good. Do I have a motion?
I'll move.
Okay, Jamie moved. Do I have a second?
I'll second.
Nick seconded. Is there any more discussion? All in favor? Opposed? It passed unanimously. Okay. Thank you. The audit firm and cost report quotes.
We already talked about that and when we talked about the finance.
Oh,
stuff,
okay.
so,
Skip the
yeah.
long-term.
Oh, that's right. That's
So we have offered a position and we're
I'm
still
sorry, I
waiting to
didn't see
hear back. So that's where we're at with that.
Is that someone here?
Yeah.
okay. Moving on with,
Matchsticks, matchbox, matching tie to matching socks. You don't know why, but you're really special to match point, match game. You and I are not the same, but I can tell that you're really special to me. There is something I can give to make you laugh, to help you live. We're the perfect match, and you're really special to me. We're the perfect match, and you're really special to me.
new business. Website, is that correct? Am I on the right?
Yep.
Place?
So on the strategic plan, you guys had update or revamp the website. So we have been working with Denise on quotes for the website. And so we looked at these with Denise. So we got 3 quotes. And so these were in your board packet. And I don't know how well those will pull up. So we got 3. And I don't know if you want to kind of talk about them, Denise, since you're kind of familiar with the website, or.
And Piper, just so you know, they're not on the screen.
Okay, I'm trying to get them all pulled up here.
You're good. Thank you.
Did you put this out in an RFP?
We just got 3 quotes from 3 different vendors. Yeah. So this first one is, let's see if I can share it without the screen going black again. Can you see that now, Allison?
Yeah,
this
thanks.
First one is Fast Health.
You want me to talk about?
Yeah.
So Fast Health is a company that does hospital websites, and they do critical access hospitals. The cons, I guess, with them is they are $600.
$600 a month, and the setup fee is $3,800.
Have you seen any of their sites?
So yes, so they have some examples. If you go through their presentation, they have some examples on the last page of some of their hospitals.
And the other downside, I guess, that I saw was that I felt that because they make the website, their Fast Health is really big on there. You know, not that I don't want them to be recognized as doing the website, but I just,
A lot of self-promoting.
Yeah,
yes. it
good
was
way to
just-
put it.
Yes, it was.
In other words, we're paying for their advertising.
Yeah.
Exactly, exactly. And it was big. It wasn't something.
Yeah.
Was my downside.
Okay, and the next one is EOT or ZAIDS.
So this one is Dave's. Can I talk about this one, Denise? This one is just, I mean, there's not a lot.
Yeah,
here
there
to
isn't.
quote.
He's very reasonably priced, and I think he would be very good to work with and easily accessed.
And theirs is just 4,500 even?
Yep, and that's just a one-time fee, and then he would train our staff to maintain it.
Is this the local guy?
Yeah, this is my son.
Oh.
So he would be accessible.
Yeah. I was trying not to point to his mother, but.
Yeah.
She knows how to get a hold of him.
And I don't know if he put on here any of the other websites he's done, but I can give you those too if you want to look at other websites he's done.
Now, when it says website maintenance and upkeep, do we have, that doesn't cost?
It says
anything?
He would train our staff to do that, or he would be available.
So that's basically in-house.
Yep,
Mhm.
yep.
It says he would be available for $30 an hour.
Yeah, if there was additional training or any stuff that Denise couldn't,
Or
Yeah.
he could, or nobody else could do it and he
yeah,
Yeah.
yeah.
Gotcha. Okay.
And then this is the dot. I'll talk about this one, Denise. This is the most expensive one. This one was a one-time cost of $11,000.
The main thing I liked about this one is that they use the same setup that we have now, which would make it easier for me, but it's not like I couldn't learn something else. So, that's what I liked about them but, you know, I mean, that's a lot of money.
Is that one time or is that?
That's one time and then a monthly fee. Is the monthly fee just $85?
85,
Yeah. So it's the minimum monthly fee, but
85
month.
It should be a monthly fee, $11,000.
So Denise, do they all offer the same thing?
Looks like it's a little different.
They all offer their own unique little specialities, I guess you could say.
I guess my question is are they doing the clinics too? All three of these do the clinics?
It would include all our stuff.
It would,
Yeah, everything. It would include.
We do it all under one
Pharmacy.
umbrella.
Yeah,
We
Okay.
could, we just have kept it all under one umbrella, so it's easier.
Sure.
Me to me.
I didn't see Upton and Newcastle clinics on any of the others but this one, so I just wondered.
Oh,
So it would include all our entities. Everything that we currently have on our website would be included on everything.
Just as a point of reference, a lot of the hospitals I work with use a company called Scorpion for their websites.
Okay.
Okay.
Denise, have they given you any examples of what they would do for us?
we saw examples of all the websites. We, was pulled up, and so we got to see what each of them does, and, I thought they were all good. I guess I don't have My least would be the fast health.
What's the issue with the current website? What's the,
It's just me
okay,
with no
so
assistance.
you're running all this?
Yeah.
Oh,
I do it all by myself, yes.
You just host through, who are you hosting it through?
Web hosting hub.
Okay. It's a lot of work.
I know.
It is, and then when I don't know how to do something, it's a little hard.
Right.
And what is it we're actually looking for? Maybe that's something the
What do
board
you
needs
want,
to.
yeah, what do you want the website to say and do, and what's the goal? Yes.
Well, it was just on the strategic plan, to update.
Okay.
Didn't we talk about like improving the marketing? and-
Yeah.
Yeah.
I think that's what we were.
It's part of our marketing
Yeah.
strategy. Yeah.
And I'm willing to do any training if you,
Do you know how many people
Want to do that.
access our website?
so we do have that. I don't have that right with me.
Okay.
We do have it. The number is pretty high because it's on all of our computers.
Oh, sure. Okay.
So whenever we pull it up,
So it's a little inflated.
it is
Yeah.
a little inflated.
If you're looking
I'm
at
gonna be
marketing.
honest with you and
Yeah.
tell you it is.
Yeah.
inflated.
Yeah. Because everybody at the hospital uses it.
Yeah.
Mhm.
Yeah.
Yeah.
So it's something that we can
Sure.
think about, talk about.
Well, and maybe is we need to come up with what we really
Yeah.
want.
Yeah.
Okay, we're
And look-
looking at,
And look at other
Yeah.
hospital websites and see
Mhm.
what you want out there and
Yeah.
see what kind of things you want available out on the website.
Well, like this last one, it says, a website new build and a website hosting and maintenance, but I don't see any other checks on that agreement. It says marketing strategy meetings, but it's not checked. Website updates, it's not checked.
you're talking Dot.
Yeah.
Yeah, because
Yeah.
we would just ask for a straight new site where we would we want it to do
Oh,
the maintenance because we don't want to have to, we don't want a huge monthly cost.
That's what
Yeah.
happened, well, and what happened before was we did have a company locally here in town and he just didn't respond to me anymore.
oh,
And so then I just learned how to figure out how to do it myself, so.
Yeah.
and you do a good job, by the way.
Yeah.
Denise, are there some things that you would like to see from a new vendor?
I guess I want us to be, what's the word I want? Look new and up and
Yeah.
coming. Do you know what I mean? I want it to look sharp.
Mhm.
And with the, trying to figure out how to.
User friendly.
Yes,
Yeah.
and user friendly and just easy for me to maintain so that I can, and I like where the website we have now, I have on the side, I have different stuff. They think that's nice for people to see but I would like the monthly calendar, or the calendar a little more accessible than what it is now.
Mm.
You have to go to a page and I just need to sit down and figure out how to put it on the front. But the calendar is very nice because it goes in and it shows and then I keep it updated so they can even go there into, as far as we know, for the specialty clinics and that information, so.
So I would recommend we table this, do a little bit more research ourselves and then maybe come up with what direction we feel like we need to.
I was wondering about the transparency, the act. Is this gonna be able to be on this new one? With all of our fees
It
and,
has to be, yeah.
Yeah, it's on this one.
Okay.
So it would have to
okay.
Yeah, we have to have our fee schedule on
Is it-
there and the
is it
estimator.
Easier to use than what we have now.
That would be the goal.
Yeah.
I mean, that would be the goal.
Yeah, because for instance, when you look at the fees for the hospital
Right.
and that stuff, it's such a big
It
document.
is, it
And
is.
it takes so long and
Yeah.
it just,
It's very
it's
cumbersome.
awkward to begin with.
Yes.
And I don't know if somebody would have a better system that would work better. I guess that
We probably ought
could
to
be a
look-
question.
Probably ought to look into that because, that's gonna be a mandate. Of unfunded government mandate.
Right.
So, we need to keep that in mind. Because
Yeah,
right now they're out suing
I think
or
that's a good
finding
suggestion.
people,
Have that part of our
Mhm.
criteria.
And they've
Yeah.
added to it Isn't there 3 things we have to keep on there now?
I think so. I can't
They
remember what they are. but I think-
it's actually all ended right now. They
Right.
took the mandate away.
Oh, did they?
And
I don't know, the last I heard they were out fining.
Well, our fee schedule
No,
has
they're
to be
not
posted.
finding,
Yeah,
and
our
they're not.
fee schedule has to be out there, which is out there. And
That's
then,
not a mandate anymore. Though.
right, and then and our estimators out there with my chart.
Yeah,
Yeah, so that's out there. And our fee schedule's out there. It's on the website.
okay, I think that's probably what we need to do.
Mhm.
We need a committee for that.
Are you happy with the quotes that you got, or are you looking for more?
Well, I think we would look at this
Yeah, I
Scorpion
think
if,
that's
I
a
mean,
good
if
idea.
that's,
I have a company that I worked with when I redid when we created the Republican website just this year, and he was great. So I can hook you up with him if you'd like.
yeah.
Do you know the name of that
But I
one?
think we need to hammer out what we want.
Madison
Yeah.
Avenue,
Or
just
won't do us any
something
good.
like
Cause
that.
they're gonna ask us. and
I'll get you his information.
Well, there's a good shopping list right here, you know, as far as what all we might look or might want to look at.
How's it look? I'm looking at it on the phone right now. Cause I usually look at the website via my phone. I don't really use a
Yeah, right.
desktop or anything.
It's small.
Yeah, I was like, cause that would
It
be the
is,
thing,
it
is like, how does it translate to your cell phone? Because I don't know, I mean, I use my phone for everything, I'm not.
I hear
glued to
you.
the Computer, so,
Me too.
so I mean, is it user friendly there and some links aren't popping up, I can see it already, so
There
that would be.
was, when I did the website this summer, once we had designed it all for the computer,
Yeah.
he then reformatted everything
Exactly, that's it.
because he said it had to be different for phones.
Tablets, phones, and
Yeah.
computers, yeah,
So you may want to take that down as a note.
cause that would be more user friendly.
Girl.
We got 2. We got at least
Yeah.
2.
We do. Okay, there was a motion to table this. Is that okay with everybody? Second it?
Second.
All in favor, or any more discussion? All in favor?
Right,
Aye. Yeah, motion passed. We'll table this until next month. And hopefully in the meantime, we'll figure out exactly what we want. Okay, the Wyoming Hospital Association membership.
We had briefly talked about this last month, and Eric Boley, the president of the WHA, was gonna come next month. And he can still do that. I don't know if that's necessarily what you guys would like, or if you would just like department managers or admin team to kind of come up with a list of what our organization benefits from the Wyoming.
Well, I'd like
Hospital.
that. I really would like to know what services, because I mean, we pay an annual fee, 12 grand, right?
Mhm.
And it'd be nice to know what we're getting for that 12 grand.
I know part of it is legislative.
Right, so my point, Connie, in asking for it was, how does this organization, I don't necessarily need to hear from Wyoming Hospital Association what they feel they're giving us, but I wanted to know what benefit our organization was getting from that membership. And as Piper said, I'd really like to hear from the employees and what they use it for, and if they find it to be a good resource and, worth it, then that's basically what I was looking for.
Well, and there also might be some things that we aren't currently.
That's what I was thinking, yeah.
So having him available,
Yeah.
I think is not a bad
It's a
idea.
good point.
Yeah, that's what I was thinking, is I'd like to know what services aren't we taking advantage of?
Right.
I mean, we pay the fee, we might as well get as much for our buck as we can.
Okay.
So, do you still want him to come then? Is that the plan?
Well, or even if it's over Zoom.
Even, can you just Zoom it?
I can
We
ask
do
him.
that as a board education.
Mhm.
Yeah, that's
Yeah.
what we're gonna do.
Okay, okay, gotcha.
So do you want to set that up for next month? then? Okay, next is the blood bank refrigerator.
So the blood bank refrigerator,
Do we have a blood bank?
yeah. We do.
Well, it's not large, but
We keep 6 units, but it died. It really died. So we had to get 3 quotes They're all right around 4,000, but we did get a quote for one that was like 3,000 something. Anyway, Jim said the cheapest one would work, so we just need approval to purchase the.
Which one was that?
And these are new, correct?
Yes.
Yeah.
That
There's
wasn't for
this
blood
different-
bank. That was a different one.
Okay, so we have,
It was still in the lab though, wasn't it?
Mm-hmm.
Mhm.
was it a freezer or?
It was a freezer.
It was a freezer.
Oh, okay, see, I thought
Yeah.
it was a refrigerator too. Okay, so Disher Healthcare has two of them. And the other one was,
There's 3,625.
what name is that? Oh,
Bullet.
Bullet?
Mm-hmm.
I suppose they need this ASAP, don't they?
Mm-hmm.
Yes.
Okay. I would entertain a motion.
I make a motion, we purchase the cheapest one. That will work.
Okay. Can I have a second?
I'll second it.
Okay, Dottie seconds it. Any more discussion? All in favor, signal by saying aye.
Aye.
Opposed, same sign. Motion passes. Okay. Now we have the PFT, Spiro, whatever that is. Yeah, that thing.
So the PFT machine, we have one at the clinic, but it's older and the printer quit working and it's one piece of equipment. It's not like the printer is separate, but we use it for, some of our contract stuff we do for the refinery when we do their, employee exams and for 21 Electric, and it's just contract stuff we do. So it's all cash stuff. So we need to replace it, but it's about $2,500, Angie. And so we just need approval to purchase a new one.
And this is for the clinic, right?
Yeah, they do them at the clinic.
Okay,
Yeah.
so it's both clinics or just the one?
Just the one. We
Okay.
just have one for all
Do you
three.
need another one? Upton or not?
No, because like I said, it's contracted. We don't do
Oh.
it. I mean, it's a contracted service that we, like I said, do for
Oh, so
employees.
it's not something.
It's the providers don't really order them that often.
Okay.
A lot of times pulmonologists order them, I
Right.
suppose. But it's not really something that we have a lot. I suppose occasionally they might order them, but for the most part, we use it for those contracted things, for those employee testing, NIOSH testing,
And how much was that one?
$2,500.
So Piper, if they order PFTs at the hospital for some reason, do you take it over there?
We could send them to the clinic to do it, or we could
Okay.
bring the machine over. I mean, it's not very big.
I was just curious. Thank you.
Quite portable, you're saying.
Yeah.
Mhm.
Okay. Well, I would entertain a motion.
I'll make one.
Thank you, Connie. Second,
Second.
Nick seconds. Is there any more discussion? All in favor by signifying by saying aye.
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 Opposed? Motion carries. Okay, and what do we got here?
The hiring policy, I guess Dottie had made
Well, yeah,
Are we gonna table that, Leanne?
I think we are.
Yeah.
I think because this, what we were trying to do is because our bylaws have that provision there, we were trying to combine it with our hiring policy to make it cohesive.
Okay.
And since we don't have the monument contract revised yet, we don't know exactly what it's gonna look like.
Okay.
So we're thinking we might as well just hold off on that until we know exactly what we're dealing with, so.
Okay.
But we could go over the admin part if you want.
Okay,
So I have time to fix the grammar.
yeah.
And where's this located?
Yeah, where's it at?
I don't know.
It's in the board package.
It's in the board packet, yeah.
Yeah, I did.
And what was it called?
Hiring policy.
It's a hiring policy. We sent this out. I believe Charlie sent it out to all the board members when we got it together. The governance committee worked on, adding
So
to
it's
the
in-
hiring.
No.
No, it's in the
I
packet.
sent it in an email and I put it in the board.
Okay.
Is it in the March board packet or the February?
It might actually just be, now that I think about it, it's just floating out there somewhere.
That's what I thought.
We didn't have a,
Yeah, I did too. I read it, but I can't
we
tell
didn't
you.
have a March folder when I put it in there for some reasons.
So let me
So,
look.
so it's two pieces. The first part is regarding the CEO piece, which we're going to table until we have the contract. The second piece, can you guys hear me?
Yes, yes, go ahead.
Okay. The second piece is according to the bylaws. And some of the issues that we had in the past that we can actually avoid if we move to use this piece. And what I wanted to be sure to tell you is that if you look in your email and you see the hiring policy, this is way down the end of the policy, because I didn't know whether to add it as an addendum. So I contacted Charlie for his expertise to put this together. And so he opted to put it at the end of this policy. So it's okay. So if you move up just a little bit for me, Piper. Down, I'm sorry. So keep going. Okay, keep going. So it starts out with Board of Trustees by the bylaws, blah, 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 and then CEO selection. So keep going down till we get to the next
see.
piece. Yeah, administrative selection. There you go. So what it basically is saying that the administrators or the directors, if there's a resignation, a retirement, or release, the hiring manager will notify the CEO, who will in turn notify the Board of Trustees before the employee leaves, because we had some incidences in the past where people just left and we didn't know anything about it. And the thought behind that is to kind of find out why people are leaving and perhaps even help them to see what their issues are or whatever. But so then it says the CEO and the board will collaborate as necessary to rehire and as to the potential salary. So in other words, the CEO will come to the board and say, so-and-so is leaving. And we'll say, well, yes, you have to certainly fill that position. And then, after the fact, we could talk about potential salary, because we want to try to keep it at market value. But in some cases, we don't want to overpay. So if the position is deemed necessary, which I just talked about, then the CEO or hiring manager, which would be a hiring manager would be, say, somebody like Angie or Charlie or that level of people. We don't want to control or know about or deal with every single employee hire or whatever. We're just talking about the people that are in the admin positions. So they'll notify HR and then the position will get posted, and then we'll just follow the regular HR process. And the hiring manager will do that with HR. Look at the resumes, decide who they're going to interview, do the interviews, however they usually do it. And then once the candidate is chosen, the CEO will discuss the selection at the next board meeting or at a special meeting if necessary. And at this time, the board will approve or discuss the offer, including salary, which will be again at the market value, close to the market value. And then the manager will make will have HR make the offer per the process, pending all the usual processes with HR, and then we just move along. So this way, the board knows who at a very top level is leaving and for what reason, and and then talk about the hiring. So this is all per our bylaws. So if there's any questions or people have.
In the CEO section, we're not sure, what we're gonna do with that yet. So that's the
Right.
part that we're gonna need to hold
Right,
off on.
Because we didn't have a process.
Yeah,
So-
right.
So can I ask
So
a quick about what you just said? So the board now is gonna decide what administrators make in this hospital? Because that's what this sounds like. It is exactly what it sounds like.
Well, it's a public hospital.
I get that. But will you make it sound like You are gonna decide what your administrators make and if their positions are required or not. That's what this sounds like from the outside, just so you
And
know.
that's what we're responsible for.
Yeah. We hire the CEO,
The CEO. You're talking about all the rest of admin.
admin. If
Right.
admin leaves and she usually, I mean, we usually get that information.
Right, we've
You
always
know.
gotten it, but we've never discussed in the board what we're gonna pay,
What their salary.
what somebody's salary was gonna be, and whether or not their position, unless we were really, really trying to cut positions, whether or not their position was really necessary. I think you're just taking one more step at micromanaging your manager.
Well,
I mean, that's my opinion, but I'm putting it out there for you that it's a slippery slope. Because you're gonna start here, and what are you managing next?
well, I think the process is that we had some admin people leave. And we could have maybe saved them, or we could have maybe had some help with saving them. So that's why, if to stop the retention, or encourage retention and stop the leaving, you know.
I get trying to do
Yeah.
interviews before they go. It's always been a problem. It's always gonna be a problem.
Mhm.
I mean, it's not the first time we've tried to come up with ideas to get people to actually speak before they go. They're mad, they go. I mean,
And they don't always want to.
they don't wanna speak, or they're not honest. I mean,
Well,
we.
It's really,
I'm
it's
thinking
really
here-
not the purpose, it's really not the purpose to say whether or not a position is necessary. It's more to say that, you know, if there's a position that's going to be added that we currently don't have, and those kinds of discussions, it's really not intended to be the micromanagement that you're talking about. It's really more to be in the know, have knowledge, you know, work with the CEO. And they're doing the whole process. They would pick everybody themselves. And as far as the salary goes, that it would be just to have an idea that we stay within where we need to be, because we don't want to have through the roof salaries that are given to new people to come on board when we don't really have a ton of money to spend. So we want to get to as close to the market value as possible, like we always do. We just want to make sure that that's where we're staying.
And so in the future, this board may completely change. So what safeguards do we make sure we have? So in the future, it doesn't become exactly what you said, somebody dictating and so forth. So I think that's an important component to make sure that we're addressing, you know, I totally get what George is saying, and I totally get what you're saying. So how do we meet in the middle with safeguards?
Well, I think the wage thing, you know, we haven't ever been told what the wage matrix was. And even though that's public information. So
What do you mean we haven't been told?
Well, I've never seen the wage matrix. Have
I
you?
did.
I did training on it
Yeah.
Yeah, I've seen them.
personally.
Was it the one we got the other day?
No.
No, I did education here, training on it.
Well,
For the new board members.
You guys remember that?
Yes, but there was no dollars attached to it. It was a basic overview of
How the matrix worked.
Yeah.
How the
Yeah.
matrix worked,
So-
but
Yeah.
not the actual matrix.
Oh, I see what you're saying.
Yeah,
This is detailed.
yeah, it wasn't detailed,
Yeah.
right.
Yeah.
It just showed how the matrix worked.
Well, and I
Starting
guess,
in
and
the-
I will say sometimes in the past that we've seen what other hospitals were paying in.
Well, we used to use the Wyoming Hospital Association. And I don't know about you, but I think the prices are terribly inflated, but.
That's because you're not working in healthcare. No one's working in healthcare. No, but yeah.
You see what I'm saying, though? I mean, and so I think we need to look at that, a wage study or something, just to see make sure that people aren't being hired in higher than the rate that they're supposed to be hired in.
Can I just mention something? We've had many people just leave. They're making more in Custer.
I mean,
$4 or $5 more income stream.
how much
$3, $4, $5 more income stream.
is this dietary?
No, this is
No.
other, this is nurses, CNA.
Really?
More income stream. So just.
Healthcare currently right now is extremely expensive because they're so limited in staff.
Supply and
We
demand.
feel it,
I
we
understand
know.
it.
Well, there are less nursing students coming out.
Yeah.
I know, and less people going in.
I'm
Yeah.
not saying because of dietary, because my staff's the least paid in this place, so.
So don't do that. Yeah.
No, so I understand that sometimes when you're not involved in it, it does feel extremely inflated, but if we were to look at, say, insurance company people, we go, oh, that's ridiculous. Oh, that's crazy. Well, is it? It's because that's what's going on in their industry. So going back to the point, I, as a board member, don't want to be the one that is suggesting the salaries. I want the administrator to say, this is what we're proposing and this is why.
And that's what this says.
Yeah.
That's what it says in
The language says
That's what-
collaborate,
So,
whatever that means. I mean,
right.
it just says collaborate. It doesn't say anything other than collaborate, which,
Agreed.
Could mean anything.
right.
Right. And believe me when I tell you that this was written to support the bylaws. The bylaws quote that, the board is ultimately responsible for the hospital, the employees, and so on and so forth. And so, we, like I said, it is the job of the CEO and the directors to maintain their staff. This is only talking about the director level. The rest of the stuff, and this is just informative and as Nick said, collaborative. It's not dictating.
Yeah.
It is just a draft too. I mean, we can tweak it. So.
Draft.
It is just a draft, but we are.
And if anybody has any suggestions, how, that they want to wordsmith this or whatever, please send them along. Be happy to look at them.
Okay. What else we have?
Well, thanks for the work that whoever has been involved in putting it together.
So who has been working on this?
I think we should split up. Why? I want to meet new people who need me. Meet new people? You're my left kidney. You only need one of me, man, and you have two. There are plenty of people out there who are dying because they don't have one. Really? You'll be giving the gift of life. I could be a hero. Yeah, it's all win-win up here, buddy. Why don't you go and save a life, pal? You're doing the right thing.
Where are we at?
Department manager.
Oh, yeah, department managers.
So we have Mike from PT and Athena from OT and then McKaylee from dietary. You guys had requested some department managers, so you guys could put some names to faces. And do you guys have any questions for?
Sorry, I don't understand.
That's a good question.
Yeah.
How's your staffing?
We're still short,
Oh, yeah?
so I am picking up a lot of shifts and stuff.
Okay.
We're hoping that we have one coming in, but yeah, so I mean, it's pretty much what everywhere around here is. You're short staffed. But
So
it's
an
gotten a little bit.
example of a staffing issue. So McKaylee hired a full-time. First she was PRN, then she decided to do full-time. She went through the orientation process. She did meet and greet. We all sat down, talked with her, had, Danishes with her, and she was nice. And then she just disappeared, never showed up again. So we went through the whole onboarding orientation process and then never showed up to work a shift.
So maybe they didn't like the Danish.
Yeah. For me.
Yeah, so
that.
McKaylee has a lot of those, unfortunately, in dietary,
Yeah.
so.
I have my main crew that has been here.
I know, yeah.
Yeah, that's been here for quite a while, but we just have those 2-3 that kind of fluctuate, so that's what we're going through, trying to find one that will stick.
Does it seem to be the full times or the PRNs or?
PRNs are hard to come by. We do have one that works at the school and she works weekends with us and during the summer. But yeah, PRNs are horribly hard to keep. But no, it's been full times recently that are hard to.
So if you have PRN staff, do you work them part-time then, or, I mean, would they qualify for part-time?
Yeah, I mean, we work them as much as they want to work, or
But they just don't need the insurance.
Yeah.
Okay.
Or like they have another job, like one is she
Right,
works.
right.
weekends, so, yeah. Or people that are retired, sometimes they just want hours here and there. But yeah, so that's just been the.
Now, do the
big-
feeders come from your department, or do they?
No, they were with activities, but they are switching to the banner.
Oh,
They're
okay.
switching kind of things. But no, they work directly with us, but a nurse kind of oversees that because
Okay.
they do the training and stuff. So it's through the nursing home.
Okay.
Yeah.
Very good.
And I think it's like everything else, staffing in healthcare. You have to work holidays, you have to work nights, you
Yeah,
have to
I know
work
it.
weekends.
Yeah.
It's hard work.
It is.
It is hard work and
Yeah.
financially really not that well paid, honestly,
No.
especially for
For the work,
CNAs and such, you know.
Yeah, I think the CNA is, yeah, I agree.
The work they do
I
and the
agree.
amount of money they get, they just make more at the gas station.
Yeah.
Well, we said the housekeepers are the least appreciated and
Yeah.
most valuable because they keep the infections down.
Yeah. Yeah.
Okay,
Thank you. Look at Chicago.
thank you.
But yeah, just like kind of a glimpse of therapy. Right now we've got 3 full-time PTs, 2 full-time physical therapy assistants, 2 full-time OTs, and then they have an assistant. We've got our speech therapist who's PRN, and then Becky, our office gal. Kind of some highlights from last year and things we're looking forward to this year. Last year, a lot of us physical therapy staff got lifeguard certified, so we've been able to do a little more aquatic therapy with our patients. We got 5 of us to do it just so we can, each and every one of us, if we have a patient we need to go in there with, we don't have to try to find somebody to be there. So that's starting to gain a little more popularity with some of our patients. I believe this pool is getting a ramp eventually, which I think that'll encourage a lot of our patients that are a little leery about getting in and out to be more willing to do that.
What do you do when the pool's down? Postpone?
Which we've kind of improved that communication with like the maintenance crew, because when we first started, it was kind of we show up and they're getting ready to shock the pool. And
Yeah.
you're like, nope. So we fine-tuned that communication a little bit so that there's kind of a week by week communication of, okay, these are the times that won't work. Work around that. So it hasn't been too much of an issue. Yeah, if it's just going to be down for a major repair, we haven't really dealt with that yet. And something else, like right now, and correct me if I'm wrong, you and Cassie doing the lymphedema certification training, so then that'll be really helpful. They'll both be certified to do lymphedema treatments. But right now, we're kind of having to send people away. I know Custer catches some of them, and I think the other medical clinic downtown is doing some of that, so that'll be nice. We've got a bunch of our staff does a lot with the local high school athletics. One thing we've kind of been in talks with the coaches about trying to develop like a program over the summer, kind of a injury prevention acceleration program. Shanae and I went and met with the coaches at the end of January just to kind of get a feel for the interest there. And we're just still kind of trying to get them to give us feedback of what kind of interest there is, like each sport, how many athletes we'd be looking at, and from there we can kind of develop our pricing and a schedule. So a few of the staff are going to be doing a training at the end of this month, like emergency response for like athletics. So just kind of getting more in depth for dealing with probably the more catastrophic potential injuries. So that'll because right now we have therapy staff that are going to a lot of the high school athletics, middle school athletics to help cover that. So get some more training there. Along with our full-time staff, right now we've had a fair number of like physical therapy assistant students that come up from Laramie County Community College. I've been in email contact with their director right now. They're going to try to place a student with us this fall and then next spring semester. And then I also got, I don't know if they contacted you, and then Hanover College in Indiana actually is trying to place, interested in placing physical therapy students here for one of the rotations. Right in the process of kind of figuring out what their dates are and trying to coordinate that. I just don't want it to have like too many students at once.
Bumping into each other.
Yeah.
Hours of operation.
So typically 7 to 5:30, but that always, I mean, there's a little fluctuation there. Sometimes you have the patient that just, hey, I just can't get off work in time. So sometimes we try to accommodate those later appointments. Physical therapy staff, we all work 410s, which kind of allows us to accommodate those earlier appointments and later appointments without running into too much overtime, hopefully. Kind of a breakdown of our patients so far. I just looked at from the start of the year until last week. Just for physical therapy, we've had, and this is just outpatient, inpatient, and home health, we've had 897 patients, or like visits, I should say. So that's
the first of the year?
Just since January. Yeah.
Really?
So that's about a week, about 100 patients a week average. That's predominantly outpatient. It was like 86% is that's outpatient traffic coming in and out. And then the rest is inpatient and home health. So again, those inpatient and outpatient, or inpatient and home health numbers, those can fluctuate on a pretty big basis. I mean, we had, I think, 4 new inpatient evaluations this week. So we see those individuals 5 times a week. So right there, boom, that's, another 20 appointments throughout the week. So, and then we also work in the school a little bit. We have, right now for physical therapy, there's 4 kids that at the elementary and middle school level that are on IEPs that we're working with. And then I think Sinead said, as far as the athletes that they're going, they kind of block out a little bit during the afternoon, or some of our staff will go to the school. It kind of fluctuates anywhere from a handful to 10 or 12 student athletes that we're working with, taping them before practice, that kind of thing.
How do you feel about the space? If you had more space, would you be able to do more? Is it adequate?
I feel like it's adequate. I mean, there's times where it's a cluster in there. I mean, there's times where there's 5 or 6 of us treating 5 or 6 people, and it gets to be, but I don't think it's detrimental. I think it almost, I mean, if there's people that like more of a private area, we have plenty of that. Like there's plenty of curtained off areas, private treatment rooms that we can go to, but a lot of people like coming in and it's like, oh, there's so-and-so, there's so-and-so. I mean, it kind of
takes you off the torture tree.
Yeah, it's kind of that therapy mentality where it's a little
Right.
Well, the reason I ask is we have the basement, over at the clinic, which is pretty good size.
Yeah.
That's why I asked the question.
Here too.
True, absolutely, so that's why I asked, do you feel like if we had more space?
Right now I feel like it's adequate. I mean, especially with the mix of inpatient, home health, I mean, it's pretty rare that we're all right there at the same time. There's usually 1 or 2 of us at a home health, someone at the school, and we try to schedule that so that we're not all in-house at the same time, which has helped.
Are you having to refuse patients because you can't get them in?
No, not
Okay,
right
good.
now.
Okay.
Right now it's definitely getting busier. Like I said, just throwing those few inpatients into the mix, I mean, that fills the schedule fast. And then the home health right now, I think we only have 2. So, but then you get 2 referrals from someone in Upton.
Yeah.
And boom, there's,
30 minutes, hour.
there's 8 hours of your week already against.
So when you get a physical therapy, doctors, do they order OT as well? Or just mostly?
We're getting more of that. That's one thing we've talked to the clinic about. And we're kind of in the process of reaching out to different referral sources in the region to get more of that, our shoulder or upper extremity referrals.
Right.
So we're seeing more referrals that are coming in physical/occupational therapy, so we
Right.
can kind of pick and choose, you know. If physical therapy side has more openings and we get an elbow referral, we can take it.
Right.
Or if we're kind of filled up, they have more opportunities, then they can get them started. It just helps them get their treatment started sooner.
So if you have a skilled swing bed patient and they get ready to go home, do you send OT home with them, or
Yeah, typically
you do?
most of the time we're doing at least a home health evaluation
Yeah.
with both.
Okay.
And that, we don't necessarily have to pick them up both.
Right.
Proctor, both of us, and OTs, mostly OT is doing like our home evals before they go
Right.
home, just to make sure they have everything set up they need to have to be more successful when they go home.
Sure. You like your job?
Oh, yeah.
I knew you did. Is she? Perfect.
What other services do you think in the future might be a possibility?
I mean, that's a good question, because therapy is one of those where there's definitely room for specialties and kind of having a niche, but at the same time, in a rural community, it's almost like it's more of a jack of all trades type of scenario where you kind of have to pick and choose.
Don't you?
Somebody told me we should start doing acupuncture.
Mike does do
Mike
dry
does.
needling.
I watched him do it one day.
Yeah. Mike does dry needling. Mike does wound care.
Do you have much wound care?
Right now, I have one guy, I think, and that's another one that kind of might have 3 all of a sudden.
Yeah. Yeah.
I don't see it for months.
Do you do stuff at the manor then too on wound care? Or?
I've never done wound care in the manor,
Okay.
and as far as the manor, I mean, that's another thing we kind of work with the restorative program over there. So we have a manor resident that ends up in the hospital. We do therapy with them. Once they discharge and go back over there, we kind of update their restorative program.
Right. So they take over. Okay. Okay. Any questions? Further questions?
I just want to say from a numbers perspective, you guys always look great.
Yeah.
The department, I always, every month when I look at it, I say, ooh, I wish everyone could look like the therapy department. So thank you for that.
And that's one thing I mean, since I've been here, there's been, I think we're on our third competitor.
Mhm.
And every time a new place opens up, you're kind of waiting for that hit.
Yeah.
And it's never been.
Good.
I think another thing impressive about the departments is how much they're involved with the schools. Like, I didn't realize how many students do you guys see, Nathina? When it's crazy, just the
January we saw 270, February 261.
schools.
Yeah,
We see
the
about
OT program is big in the schools.
In the schools, her
and Mickey do a lot with the school and the children's center because they travel to Moorcroft, Hewlett, or
Oh,
the
really?
preschool. Yeah.
I didn't know.
Yeah.
Yeah.
Yeah, and Upton, yeah. So we have that contract with the Children's Center with Region 3. And so they do all those little kids too, the little kids for OT services. So,
and the community loves PT here. They do.
Mhm. Well, I appreciate that you're reaching out to the providers in other communities.
Yes.
Because, they want you to drive to Rapid City 3 times a week.
Yeah.
Yeah.
Hello.
Yeah, we get a lot of our patients that are like, yeah, they were trying to schedule me over there.
I
Why would I
know.
do that?
Yeah.
Why would I drive over there twice a week? So sometimes they.
But our docs do pretty good, right?
Yeah, yeah,
Okay.
our docs are great. I just think it's a lot like the orthopedic. They just don't know.
Yeah, that's right.
They just
Yeah.
kind of have their go-to
Yeah.
places.
They get in the groove of doing the same person all the time. And
Same thing with pharmacy. though.
Yeah.
Yeah.
Okay. Well, thank you very much.
Thank you guys.
So if you have a headache, I've got mine.
Yeah.
Yeah.
Yep, you guys can go.
Okay. Thank
You
you.
can go to the basketball tournament.
Yes.
Thank you.
Hey, see you tomorrow.
Is that all of them, or do we have more?
Nope, that's it. That's it.
Okay.
We'll cycle them all through.
Okay.
No, I like that. Thank you.
Yeah.
Yeah, I think that was good. Okay, we already kind of did the governance things. The foundation. Dottie, you're still there?
Yeah, I am still here.
Okay.
Foundation was canceled last month because of weather.
Okay. And ethics is quarterly, and that's coming up.
The time has changed.
Oh, really? What is it?
You put 3 in your email. We used to do it at 4.
I think it's 4.
Well, the email said 3.
I know, I had the same thing with my finance meeting.
So I
Yeah, so it is 4, right?
That's what it used to be.
It's at 4.
It's at 4.
It is
Okay.
at 4, okay.
All right.
Very good, thank you. And it's on that
15th. The 15th Wednesday.
Okay. Wednesday?
Yep.
Okay. And, I really don't have much to say on the president communication. Cause I don't have any financials, so I don't know. And board member comments, is there any more board member
I
comments?
have just one suggestion,
Okay.
just for the sake of the department people. I think they should get to go first, so they don't have to sit
That's
there
good.
through the
Mhm.
whole.
Okay.
Just,
That's a good idea.
well, yeah, because then they work and probably like to.
Yeah.
Just.
I think you're right, yeah. We'll have to make sure and change that around. Okay.
I just like to say,
Yeah.
thank you to the.
The diehard.
Thank you.
Thank you for coming.
Okay, items for the
Thank you.
future. Items for the future are, the West County Health Fair is Saturday, April 1st at the Senior Center. Are you okay with staff or people for that, or do you need more people, or?
More staff. Well, we have a committee and
Oh, good, okay.
we'll get that together, but I'm getting more vendors every day and health information people. So I think it's gonna be good.
Okay, good. And then the golf tournament, got another golfer coming.
Mm-hmm.
On Saturday, June, 10th.
Hopefully no storms.
Yeah.
And then board education, what is that?
That's from the Wyoming Hospital
Oh, it is?
Association. Yep.
The
Oh, they
VHA.
moved it to Casper.
Yep. So as soon as I get the official flyer, I'll email it
Okay.
to you guys. But Eric had just mentioned it to me when I had talked to him about,
Okay.
but he said there'll be board education on the 18th.
Is that the same thing as last year?
I
Riverton?
I believe so. I believe it's similar. He said it's the annual trustee education, so I'm sure it's the same.
Okay.
It's normally not the same training.
Right, but it is,
No,
yeah.
different vendors.
Right, yeah,
Different
yeah,
vendors.
yeah. It's the annual training.
Same.
Different topic.
Yeah.
Yeah.
Okay.
You've gone a couple of things.
Yeah.
Do you think it was worthwhile?
Pardon me?
Do you think it was worthwhile?
I always. Yeah. We were probably the last hospital in the state.
Okay. Do we have a motion to go into exec session?
We have to second it in.
Okay.
She had a motion and she got it.
She motion.
Okay, where are we at? Second?
Leaving our regular meeting.
Oh, okay. Go into
I'll
exec.
second it.
Okay.
And I'm in favor.
Did you get all that?
Aye.
I did. Okay, all in favor?
Aye.
Opposed?
Aye.
Okay, thank you.